In this video, we'll talk about DNB and how it differs from the traditional degrees like the MD, MS, MCH, and DM. Okay, so DNB stands for Diplomat of National Board. Mind you, it is not a diploma, it is a 3-year program just like the MD and MS. And just like the MD and MS, again, we require a thesis or dissertation to pass the final exam. So it is equivalent to MD and MS. But why is it different? If I have to give an example, it's like Windows and Mac, like the Windows computers and Apple computer. Everyone is so used to Windows computer, so it's kind of scary to go venture into the Apple ecosystem, right? You've always used Android. How do you think you will feel like if you're supposed to use an iPhone? For youngsters, it's fine, but for people who've used Windows all their life, was so used to it, if they are told to use the Mac computer, it might be a bit difficult, right? So just like that, someone who's so used to MD, MS, MCH, DM, they think that that's the only medical degrees in India. So when a DNB person comes along, they think that, oh, he might be useless. So this prejudice is there, this mentality is there. That's why that bias towards MD, MS, MCH, DM is there. And that is why the students prefer the MD, MS, MCH, DM degrees. Like my father is MS and MCH. So if I'm supposed to do, when I thought about doing DNB, I had to think 10 times, and eventually I did not do DNB. I'm not saying it's bad, but that mentality is very difficult to change. But for people who have started doing MBBS from the time that DNB is now very normal to do, so I think in the future, like in 2025 or in 2030, people will think less about these differences because they are used to it, right? So like if someone is born in 2020, he will know and hear about DNB all his life, so he'll think that it's a very nice thing to do, right? So that's the first problem with DNB. It's not actually a problem, but I'm just saying it, okay? That's why people don't take it. The top rankers, first rank people don't usually take it. And the second thing is the exams for DNB is like normal good exam. Like if I'm supposed to go to UK, I'll face an exam, a very reasonable systematic exam. If I'm supposed to go to Australia, I'll face an exam. Just like that for DNB, if you study DNB in Bengal or Delhi or Jaipur, anywhere, your exam might be in Chennai or Bangalore. So your exam is in a new environment, in front of new people, with patients that you've never seen before. But for MD, MS, MCH, and DM, your exam is held in your college, in your ward, so you might be aware of the patients that are kept for the exam. And if you fall into any difficulty during the exam, your professors are always there to help you, so you can pass by grace. But there's no passing by grace in DNB. The impression that you make on that exam day is the last impression that you can make. That's the first and last impression. So I think that the DNB exam is the actual exam that should be there for every medical student. But if one is asked to choose, obviously one will choose the more comfortable, convenient exam, right? The DNB exams are the real exams, so it's kind of difficult to pass. And it's not very difficult, okay? If you are someone who thinks that you're going to pass your MSMD exam only by grace and not by your own performance, then fine, you should not take DNB for this reason. But if you're someone who's average or above average, and if you think of getting the top rank or in the top 3 ranks and all, there should be no problem for you to pass in DNB. Not at all, absolutely not. That is my opinion, all right? Now the third difference, or third thing, is someone who pursues MD or MS in whatever subject. Like I am a surgeon, so I'll talk about myself. After doing MBBS, when I've pursued, I've done MS in general surgery, now I can appear for the final exam of DNB. Right? I can use those 3 years of training for my MS degree as the eligibility to appear in the final exam of DNB and get the DNB degree. But someone who has DNB general surgery cannot just give an exam and get the MS general surgery degree. He has to go through the whole process, the whole 3 years training again in a MS general surgery college to get the MS degree. And I can also get my MCH plastic surgery degree, and after passing that I can appear for the Doctorate of National Board Plastic Surgery exam and get that degree without going through all that training again. So I can be I can be MBBS, MS General Surgery, DNB General Surgery, MCH Plastic Surgery, and Doctorate of National Board Plastic Surgery. I can get all these degrees. But had I done DNB General Surgery, I'll be MBBS, then DNB General Surgery, and then whatever degree I do after that. So if you do these traditional degrees, MD/MS, you can get the DNB degree as well. If you do MCH or DM, you can get the Doctorate of National Board degree as well, but not vice versa. Apart from this, I'm not trying to discourage you from DNB. I'm saying that these three are the only problems or issues about DNB that you should think about. Apart from this, there's no difference. There are so many DNB hospitals, hospitals which conduct DNB general surgery programs, which are way better than the college where I did my MS general surgery. So there should be no overall comparison between DNB and MS general surgery, for example, in terms of knowledge and experience. You can get very high experience and knowledge in MS, or very low in DNB. You can get very high experience in MS or in your DNB, or you can get very low. So that depends on the individual hospital or the institute that you're studying in, you're choosing. So obviously you should be aware of that. You should not join a very bad DNB program and then curse about DNB, or you cannot join the best MDMS program and say that MDMS is the best and DNB is useless. No, that cannot be done. A very good DNB program can be way better than an average MS program. So if you get a very good DNB seat, you should take it. If you're not concerned with the final exam passing and the ability to take the other degree as well, think of it like this. After getting MS general surgery, if someone wants DNB degree, which one is better? He has MS, he still wants DNB degree also. He wants to add DNB in his resume. So that means DNB could be the better thing. If he has MB, if MS was better in every way, then someone who has MS degree, why should they go for the DNB exam? So all this can be very debatable.